it can cause autoimmune-looking disorders, which can give you elevated antibodies that look like you have rheumatoid arthritis, look like you may have Sjogren's disease, or mixed connective disease, or lupus. Or, if it's overwhelmed your antibodies, you don't produce them. So you could be really, really sick, and your Western blot's going to be negative. Because the Western blot is based on your immune function. The Western blot is basically, it takes the bug, it cuts it up into, lots of little pieces, and it sees how your body reacts to those specific pieces. How it reacts to the flagella part, the squiggly tail part, to the body. If your immune function is really bad, you may not get any of that. And what do? And the paradox is that the more ill the patient is, the more likely your Western blot is going to be negative. Now, spinal tap typically is how you would diagnose the neurological meningitis-type symptoms of Lyme. Unfortunately, the evidence is that only 9% of spinal fluid is positive. It typically changes if you actually give someone antibiotics. It may actually improve. And the other problem is that some of the IgM or some of the antibodies that are actually looked at have cross-reactivity with other bugs, other viruses. Specifically, if any of you have seen band 41, it's useless. And yet, in the CDC criteria for needing 3 bands, it's one of the 3 bands. It can be positive with H. pylori, with parvovirus, Epstein-Barr virus as well. And many people have Epstein-Barr virus. So again, fatigue, headache, light, sound sensitivity, anxiety, depression, rage, tics, blood pressure problems, increased weight gain, hot and cold intolerances, GI disturbances. So lab results support the diagnosis, but they don't exclude the diagnosis. There needs to be multiple lines of evidence. We are in an endemic area. And even with this endemic area, according to Dutchess County, which is the highest prevalence of Lyme in the country, only 17% of the people actually remember getting bit by a tick. And rash, and not just the bullseye rash, but any rash, only occurs about 36% of the time. So there has to be not only the sign, symptom, your history, your story, but specific and non-specific testing. So these are some of the testing that's coming on, and I know some of you may be interested in there's a new test that's a culture test that's out, which is very new. We don't have a lot of information on it. The company reports an 80% efficacy rate for it. The problem with it is, one, the cost. It's a very high cost. It's about $600. The other is that you have to be off antibiotics for at least 4 weeks until you're tested. So for people with chronic conditions, that could be problematic. And given New York State's environment, you can't be a licensed New York State physician or practitioner to prescribe the test. Yet, I also have a license in Vermont. So that just will tell you that I can actually order the test, but that's the... there is a test out that's called the Borrelia ELISpot, which actually is very promising. It's actually being used for tuberculosis, which the results can indicate an infection within 24 hours. It's not yet FDA approved for Lyme, but it may be in the pipeline. And I also want to tell you that, look, you know, if everything fit into a box, then, you know, medicine would be pretty easy. And I don't know, it wouldn't be that much fun for me. But it doesn't. So tuberculosis is a chronic infectious disease that takes anywhere from 9 months to a year to eradicate. Typically, you need 3 to 4 antibiotics because of the resistance problem. Malaria, multiple resistant strains, takes multiple different antibiotics, can take weeks to months to eradicate. HIV, which is another infectious disease that you all know, takes a lifetime. So to say that Lyme disease can be treated with 10 days or 20 days does not fit the model that we as physicians typically look at for treatment. Now, I'm an ER doc. And as an ER doc, I've been doing this for 20 years. 20 years ago, you came in with chest pain. I got an EKG. I got some lab tests that were not really that great. But I got an EKG. Your EKG looked normal. Yeah, you're pretty good. You know, one test, you know. Your story sounds suspicious, but one test. Now, if I got the test that we had 20 years ago, the lab test, and if I used it on the patient that I had a few days ago, who was 40 years old, otherwise healthy guy, been having about 2 to 3 days of chest pain, not feeling well, kind of his pain was really in his gut, so he thought it was really indigestion, right? Different symptoms, right? Got an EKG. EKG was normal. Got a CPK, which is a typical test for heart attacks, done 20 years ago. Not real effective because it doesn't show up that well and it actually goes away pretty quickly. His CPK was negative. But a test that's been used now for about 10 to 12 years, which is called the troponin, was significantly positive. He was having an acute on chronic heart attack. A balloon pump later, and his artery was unblocked. We have to look at all aspects of what we can look at, of surveillance, of testing. You can't stop. And we don't stop in other diseases and other conditions, nor should we stop with this condition. So ELISA sensitivity is between 32 to 42%. It's useless. It should not be used. The Western blot is about 60%. But again, you can't exclude it if you have chronic Lyme disease for the reasons we just spoke about. And IgM, which is typically the early antibody, right? That's what you're told, that it shows early infection. Actually, it's seen in persistent infections. And in fact, typically those people are doing worse. And chlamydia pneumonia, not a sexually transmitted disease, chlamydia pneumonia is seen in about 86% of those patients with chronic Lyme disease as a co-infection. It can give you this kind of chronic cough. Doesn't go away. Overlapping of symptoms and ranking of symptoms may be the best way of trying to elucidate the diagnosis. So Babesia is one of the co-infections, and it's probably one of the most common. they overlap, and that's the problem. All these co-infections overlap with Lyme disease symptoms. But some of them have sort of different presentations that make it a little bit more likely. Fatigue and joint pain. But here with Babesia, the headache, and if you've not had headaches before, in other words, if you have sort of migraine headache history, then it's difficult to know. But this headache is vice-like. You feel like your head's going to explode. You typically get low-grade fever, chills, night sweats, typically without fever. It also affects your immune system and it lowers your blood count. You get a chronic cough. You get this shortness of breath or air hunger. You feel like you got to sit down. That could be Babesia. There's over 30 variants. And in 2008, Horowitz looked at ticks from this area, and Babesia was unknown here 15 years ago. He looked at ticks, and about 45% of ticks that they tested had Babesia as a co-infection. It acts similar to like malaria. Malaria does the same thing. It gives you these drenching night sweats. It has this changing of your symptoms, and it actually is treated similarly to malaria. And it typically infects red blood cells. The other thing is that you start getting better, and then it flares up again. You could become symptomatic and then less symptomatic. I mean, right? I mean, you talk about a nice way to torture you, you know? And then they move. You know, you had the pain in your left hip, now it's in your right hip. You had it in your neck, and the soles of my feet are killing me, especially when I wake up. And it can vary with your health status. If you're menstruating, if you have another infection, you got the flu or a cold, if you're on any kind of immunosuppressive medications, if there's been more stress in your life.